Good morning, Mr. Smith. Doctor said you can have that NG tube out. I was the nurse that took care of you this morning. My name is Lori again, and I'll just be taking that tube out. So the first thing I'm going to do is turn off your suction. I am going to wash my hands. I'm going to put on my gloves. And the first thing that we need to do, you're not having any pain at all, are you? You don't feel like you're distended or feel like you have to belch or anything like that? No, good. The first thing I'm going to do is make sure that I check the person's bowel sounds. They should always have bowel sounds before you pull out an NG tube, and make sure you turn your suction off before. Again, we always start in the right lower quadrant. As soon as I hear a bowel sound, all I need to do is move on to the next quadrant. I hear a bowel sound. I hear bowel sounds. I hear bowel sounds, because we need to make sure they have bowel sounds before we pull out the NG tube. What I'm going to do is actually go ahead and take the suction tube off, and I'm going to just put this in so that I can get this tubing over here out of my way. The next thing that I'm going to do is I'm going to make sure that I have a chucks in place here. I'm going to unpin this from his gown. Again, making sure not to pull it from his nose. So I'm going to just make sure that I close that so I don't get poked. The next thing that I'm going to do is actually untape this from his nose. Okay, so I'm going to just make sure not to pull on that at all. I'm going to take my piston syringe and I'm going to draw back to 30 milliliters of air, and I'm going to actually inject air into this tubing. And the reason I'm going to inject air into this tubing is there is some fluid in his tubing. There also are electrolytes and some digestive enzymes that they're going to need, and so I want to make sure that I clear the tubing of all of that so that when I pull it out, he doesn't aspirate, and we'll go into that technique in a little bit. So I'm going to go ahead and slowly push that in. Once it's in, I can keep the piston syringe on so that no secretions come out. What I want to make him do is make sure that he takes a nice deep breath in, and when he takes a nice deep breath in, I want him to hold it so that when I pull out the tube, he does not have a chance to aspirate. He has to breathe out before he can breathe back in, and by that time I will have the tube out. So we have everything ready to go. I'm going to have him take a nice deep breath, and on the count of 3, ready? 1, 2, 3. I'm going to pull it out, take a deep breath, and hold it, hold it, hold it, and put all of that into your chucks pad. And you can throw that away. Make sure that you take your pin out of there so that doesn't poke anybody. The other thing I want to do is I want to give them a Kleenex, because again, sometimes that it brings up some secretions. I would want to make sure that I do oral care again, and that I make sure that I do a good assessment on his nair that I pulled the NG tube out of. The other thing that we need to do is empty our receptacle just like we did before. We would take our final output of the NG tube, we would look at the coca, color, order, consistency, and amount, and we would then get rid of all of our fluid that's in here. We can get rid of the connection tubing. Again, we can throw all of that into the garbage, and you would follow your hospital policy in getting rid of the drainage as we talked about before when we were managing the NG tube. I then would ask him if there's anything else I can do, make sure that he's comfortable, and again, give him his call light. I would take off my gloves and get rid of my supplies. I would wash my hands, and that would be the procedure for discontinuing an NG tube.